So, welcome to my second vlog for my fellowship travel to Australia. I've got with me James Yates, who's a specialist paramedic in critical care from the Great Western Air Ambulance. He's here. I've got him in just really to talk about his role as a specialist paramedic in critical care and to just really find out about what his role is here, and then we can compare that to the same functions of the guys who work out in Australia and New Zealand. So, James, thank you for coming and having a quick chat today.
Not at all, mate.
I'd like to just start off by just introducing yourself and saying what your role is.
Cool. Well, I think you already did. But so, I'm James Yates. I'm a specialist paramedic in critical care here with the Great Western Air Ambulance charity. And that in itself is maybe interesting to people. So, I am slightly complicated, I suppose, but I'm employed by the ambulance service, but sort of seconded, I guess, full-time to the air ambulance charity, and that's because every air ambulance in the UK is charity funded, and I think that's maybe different to some other services around the world. So that is who I am.
Good, thank you. So what got you into this role, and how could you just briefly describe your career to date and the training and education that allows you to do the functions that you expect from paramedic critical care?
Yeah, absolutely. So I guess at the moment, within the sort of the higher end of clinical care, so the sort of top 5 or 10% of critically unwell patients, I guess the specialist paramedic in critical care in the UK currently represents, I guess, the pinnacle of what we're able to provide. And so the build up to that for my career has been starting out in fact I started as a technician back in the days of when there were technicians. There are still some around in the UK, but not many. And that was really a vocational ambulance service based training package to become a technician. And then from there I then undertook the degree program to train as a paramedic. I spent a few years as a paramedic, and then I joined the hazardous area response team. So that's, for those who don't know, is a team based in every ambulance service in the UK that is designed to deliver care to patients who historically, I guess, didn't get high-level paramedic care because of the situation they were in, whether that is due to sort of chemicals or height or water or firearms or any sort of unusual, dangerous situation. The heart team was then trained and able and empowered to access patients in those environments.
Cool.
So I spent a couple of years with heart, and then I actually spent some time overseas. So I went to New Zealand. I worked in Christchurch for a year and a half before coming back and joining the critical care team. So when you join the critical care team, I guess there's a whole lot of training goes on sort of simultaneously. So in the background, over the course of a year to 18 months, I undertook a postgraduate certificate in specialist practice, and that is something which the College of Paramedics, which is sort of our professional body in the UK, they recommend that as a specialist in any area of paramedicine. So whether that's research or education or primary care or critical care, that you hold a relevant postgraduate certificate. So for about, I think it was 12 months, I did a postgraduate certificate in specialist practice. And then over that time, over that year, as well as being released to go and spend time in hospital, I was also completing, in university, I was also completing hospital shifts with our emergency department and intensive care and paediatric colleagues to upskill in those areas. And I was being trained by experienced specialist paramedics in critical care and consultant colleagues in sort of pre-hospital critical care and the specifics of that. So it was a pretty full-on training package.
Brilliant, thank you. So you described that your current role is really the pinnacle of where paramedics are practicing in terms of pre-hospital critical care. Can you just describe really what your kind of scope of practice is at the moment?
Yeah, so I guess there's almost two different areas that we need to talk about. So for the majority of the time, we work here with the Great Western Air Ambulance with doctors, and that's generally consultant level doctors. And as part of the sort of the doctor critical care paramedic team, we're able to deliver a whole range of high-level interventions. I guess the most commonly used of those is pre-hospital anaesthesia. And so we deliver that almost on a daily basis. And then I get the other high-level interventions that would be delivered as part of the doctor-paramedic team would be things like thoracotomy and pre-hospital hysterectomy, resuscitative hysterectomy, hysterotomy, terminology, and then I guess amputation as well. But then there's times in which we don't work with doctors, and the nice thing about our role here is that we're empowered as specialists to work on our own with a really enhanced level of intervention and a scope of practice sort of above and beyond that of which our non-specialist colleagues who work on the road are able to do. And so that comes with an increased pharmacology, some of the surgical skills, so things like thoracostomy, surgical airway. It comes with things like ultrasound, particularly in cardiac arrest. Things like post-resuscitation care is quite a big one for us. So that's looking at things like paralysis and sedation in post-ROSC patients. It's using inotropes. It's giving blood transfusions autonomously. And I think the nice thing about our role is, amongst all of these skills and interventions that we've got, it's within not only a well-educated and it's also a well-governed system. So we have an on-call rota of consultants who are at the end of the phone, just in case we need to check anything over, or just be that kind of buddy on the end of the phone. So although we can be out there delivering care on our own, we've also got that backup if needed.
Brilliant. No, thank you. Well, hopefully that describes quite nicely the sort of scope of practice that currently specialist paramedics in critical care in the South West Ambulance Service operate. So just before we finally finish this, just where do you see this going in the future? Where do you see your role developing? How do you see it developing?
Well, I think that's really interesting, and with the help of people like you, Christian, I think the future is really bright. And certainly I've been working within pre-hospital care for a few too many years now that I don't like to count, but even when I joined the ambulance service, the model at which we're working in already was almost sort of unfathomable, really. It was very much that you joined the ambulance service, you became a paramedic, and that was really the height of where you could go with your career. The exciting thing now is that there really is sort of career progression starting to develop. So I think in the future we're going to see advanced paramedics or consultant paramedics who are not only delivering autonomously really high-level interventions, but critically and appropriately, and they've got appropriate decision-making frameworks to work from. But also we're going to have those advanced paramedics are going to be not only practicing in the system, but they're going to be governing the system, they're going to be writing the guidelines, they're going to be researching the appropriate interventions. And I think we're going to start to become, hopefully, our own autonomous profession, because I think previously we've been slightly held back potentially by other professions who maybe haven't understood pre-hospital care, and I think we're now getting to a point at which we are going to be in a position to drive it forwards.
Thanks, James. That's really useful insight into your current role. Hopefully, as I go forward with this Church Fellowship and start discussing, having the same sort of conversations with people in different environments, different countries about how they perceive their scope and their job function, we'll be able to learn from them. They'll be able to learn from us. Should be good sharing of knowledge. So, massive thanks to James Yates. So, James is also co-producer, co-author, co-writer, co-host of the Resource Room podcasts, which is it the #1?
Well, we did quite well.
It's doing quite well. It's a pretty good podcast out there, which is worth checking out. But that's it. So next, well, I'm not entirely sure what the next vlog's going to look like, but we'll see how it goes.